Mi hijo hablaba, mi hijo comía, mi hijo caminaba por sí solo. Era súper travieso. De tantos episodios, pues entonces fue que empezó a perder todo el retroceso hasta lo que es hoy en día, que ahora depende todo de mí completamente. Él no se puede lavar los dientes solo, no se baña solo, él no habla. Por la mía yo sé qué es lo que quiere. Y pues está pendiente a sus comidas y todo, y la abuela también que ya lo conoce, y aquí mi marido. Somos los ángeles guardianes de él.
El triángulo de los superhéroes.
Sí.
A mom named Iraida and her son, John Derek, born with 4 types of epilepsy. For 15 years, he's been on a downhill slide.
Todos estos son los medicamentos que toma mi hijo, 2 veces al día. Más el que se usa a restar.
¿Qué son exactamente?
Todo anticonvulsivo. Lo tengo que tener acá porque lo tengo que tener accesible al lado de él para cuando esté convulsando. Sí. Son estos, ¿ven? Que me lo dieron ahora. Y este era la pelea del medicamento. Esto vale 2.984.
¿Cómo?
2.984.
La caja.
Sí, esto nada más, mensual.
The medicine costs a fortune, but it keeps John Derek breathing during his worst bouts. Since 2008, his medical plan has paid for it. But several weeks ago, as the economic crisis here worsened, the insurance provider suddenly dropped the drug.
Yo dije que cómo es posible porque, número 1, le pregunté, ¿ustedes llamaron al especialista? Negativo. Ok. ¿Y cómo tomaron esa decisión? Nosotros tenemos aquí médico en el plan. Y entonces ahí el doctor pues le mandó la carta que me tenía que dar esos medicamentos porque si no mi hijo podía tener una muerte súbita. Mi hijo se me podía ir.
I can show you a video, Iraida says, so you understand.
¿Y duele eso?
Estas son descargas eléctricas. Afuera, porque ahí no puedo. Estos son ataques más pequeños. Son diferentes tipos de epilepsia que le dan a él.
Iraida is working class. Her husband Manuel is a security guard. She's a secretary.
Pero me gusta eso.
Each morning she drops John Derek at her mother-in-law's.
Hay otro ataque. La vida de mi hijo diaria. Sí, ya tú sabes.
John Derek has enough of his life-saving prescription to last for a few more months. After that, he's unprotected. The family is fighting the decision, but it's up against more than just an uncaring insurance company. Puerto Rico's current external debt runs to some $74 billion. When leaders declared it was unsustainable, the U.S. Congress stepped in, appointed a fiscal control board to clean house, to the tune of $1 billion in budget cuts. The belt tightening is everywhere, from education to infrastructure. Healthcare has not been spared. On top of cutbacks, this year Puerto Rico's Obamacare funds run out. That'll add an extra $300 million to the shortfall. Dr. Victor Ramos, head of Puerto Rico's Surgeons Association, says doctors are fleeing the island.
Está afectando grandemente. Nosotros teníamos en Puerto Rico 14,000 médicos para el 2006. Ahora tenemos 9,000.
Perdona, ¿a dónde han ido? Estos 5,000.
A Estados Unidos.
¿Se han marchado?
Se han marchado. Y entonces la crisis ahí, especialidad, por ejemplo, solo tenemos un cirujano cardiovascular torácico pediátrico para toda la isla. Uno.
Puerto Rico depends heavily on the federal government for health care. 4 out of 5 people are either on Medicaid for the poor or Medicare for the elderly. Yet Puerto Rico only gets a fraction of the funding per patient compared to what U.S. states get. For years, to cover that gap, Puerto Rico borrowed money, selling lucrative tax-free bonds. Combine that with misspending and corruption, and you get the picture.
Con $197 por paciente por mes, hacemos lo que en Estados Unidos hacen por $500, $600 por paciente por mes. Nosotros hacemos maravillas con los fondos que tenemos.
Pero entonces, ¿por qué Puerto Rico no recibe la misma cantidad de Medicaid?
Porque somos una colonia.
It's actually an unincorporated territory, like Guam. As such, Puerto Ricans don't pay federal income tax or receive the same benefits. The debate over whether this setup is fair has helped fuel one campaign for statehood and another for independence. Neither appears likely to prosper. In the meantime, people are suffering.
Hay mucha gente que en las camillas esperando traslado a cuarto, traslado a sala de operaciones, traslado a... y se sigue sobrecargando el centro médico mientras se sigan yendo los médicos y bajando el censo en los hospitales de la periferia.
The further out you go from San Juan, the worse things get. And it isn't just about doctors.
In Puerto Rico, we have a unique situation. Community pharmacies give service to more than 95% of the Medicaid population, the poor people. Pharmacists and pharmacy owners, they've been in business for more than 30 years, most of them. They know the people, they know the patients, they live in the communities. They provide money to the different little leagues, soccer, the church, to every little program that we have in our cities, and we help the community.
Not just filling prescriptions. These rural pharmacists also make home deliveries to the sick and elderly who can't come to town. They have more contact with patients than most doctors themselves.
Ah, pues están la de usted y la de...
65-year-old Carmen Figueroa is homebound due to arthritis and osteoporosis.
Cada vez que el médico me receta algo, él espera un ratito y ya. Pero todos los medicamentos, bien chévere.
¿Y vienen a visitarle?
Vienen exacto, vienen a visitarme. Me hacen las preguntas de si uno puede hacer las cosas sola, si uno se puede bañar solo, si hace las cosas de la casa, si necesita para ir al pueblo, para ir a buscar los medicamentos, si necesita ayuda.
With funding cuts, this essential service could disappear for thousands of Puerto Rico's neediest.
Yo no sé qué pasará si la farmacia Reyes, de verdad, no sé. Porque uno a cogerse a otra farmacia, pues tendrían que saber si esa está funcionando, si esa no se va.
Para esta administración el paciente es el centro y lo que perseguimos es que ese paciente no carezca de los servicios esenciales de salud y ha sido el norte y nuestro principal esfuerzo.
Putting a brave face on the sweeping cuts is Ángela Ávila, who manages the federal funds Puerto Rico receives for health care.
Podemos comprobar que ciertamente en cuanto a fondos federales y el pareo, la paridad de esos fondos, pues ha estado muy por debajo de lo que es la realidad en términos de costos para proveer servicios. No obstante, Puerto Rico ha hecho los ajustes para poder acomodar el servicio de acuerdo al recurso que se tiene para poderlo prestar. Así que hemos aprendido a hacer mucho más con mucho menos.
Including less practitioners, like María Mercedes Toledo, a renowned neurosurgeon. She's a stroke specialist and co-founder of this center, where she and colleagues have treated hundreds of people.
I'm a neurosurgeon and I have a specialty in open vascular and endovascular neurosurgery. That means that any problem in the blood vessels, I can fix it either opening up the head and fixing it, or I can do it from the groin up, from the inside of the vessels. There are only maybe 30 people in the United States with that training. We were doing the best neurosurgery in the island. But then, because of the economic crisis, the payments from the medical insurances stopped coming, and they started delaying our payments. I know the hospital was trying to make amends, and we would meet, and they would ask for more time. But then as it got more regular, it started building up, and we were very scarce on resources.
Toledo has given up. She's the sole breadwinner, has 2 kids. She's accepted a job in Florida. Resignation effective immediately.
I have a 13-year-old and a 7-year-old. So it was mostly with the 13-year-old. She said, "Mom, I know you figured out a way for us to stay," but I wasn't. So I think she'll be fine. We'll be fine. But it's hard for her and for me. Very. I told you I was going to try not to, but her is really what scares me the most. But I know she'll be fine.
With Toledo and another colleague leaving, Puerto Rico will be left with just 2 neurosurgeons. 2 for 3.5 million people.
I'm very sad because I will not be helping my people. I don't think the island is aware of what's going to happen, that there's not going to be any stroke treatment here for a while. And to me, that's very scary. I wouldn't want my family to be here.
Si mi vida fuera otra, en una parte que yo pudiera acostarme, que fuera una vida normal, no tener una vida de puro de correcamino, buscando siempre a alguien que me ayude para hacer las cosas. Yo no sé lo que es salir con mi hijo y que mi hijo sea normal, que pueda entender todo como lo entiendo yo, que la gente no lo vea como lo ven, que lo miran de otra forma.
John Derek and his family don't have the luxury of leaving. They're like the millions of Puerto Ricans who can only sit tight and wait for this debt crisis to be resolved, hoping that someone will pay for the medicine they need.
Que siga luchando como lo ha hecho hasta ahora, y que no se dé por vencida, y que su madre no lo va a dejar solo. Él es mi campeón.